Hello, and welcome to another ECW podcast. This year, right now, we're coming to you live from Nashville, Tennessee at the 23rd National ECW Users Conference. With me today is Orlando Perez from Betances Health Center in New York City, and we're going to be talking a little bit about optimization. Thank you so much for being with us, Orlando. We really appreciate your time here.
Thank you, Brian, for having me.
Before we get started, could you tell us a little bit about your practice?
Sure. We are FQHC located in New York City, the Lower East Side of Manhattan. We currently have two sites, one located in Manhattan and one located in Bushwick, where our main site being in Manhattan, and that's the flagship of our operations.
Okay, great. So, as I said, we want to talk about optimization this morning. I guess my first question would be, what is it that drew you to seek out ECW optimization services?
Okay, that's easy. We had a turnover of providers. And so when we lost those providers, trying to keep everything in order, standardization, workflows, and everything like that was a challenge to us as we were bringing in new providers. So we just thought it was a great opportunity to contact ECW, get the initial provider, get the new providers trained into the standardization, everything like that, and that's what drew us to the optimization.
Yeah, that's fantastic. You know, you use the word standardization, which, as we both know, is kind of a dirty word in the healthcare field. But that is one thing that that optimization can help practices with a great deal. Tell me a little about the process that you went through.
So what I did is I contacted my strategic account manager, who informed me of the services. Okay. So at that point, we contracted with them. We brought them on site. They assigned us a trainer. Mm-hmm. I think our trainer, Tahim, made the whole process very special.
That's great.
His specialty, of course, was the ECW product. Mm-hmm. So I met with him before the trainings actually started, went over some of the areas that I wanted him to touch on with the new providers, making sure he understood our workflows. So he was able to incorporate that into the trainings.
Oh, that's great.
Which for us was tremendous. Got the newer providers feeling comfortable, learned our workflows. And that's really was the helpfulest and the most important part of it.
Yeah. What would you say it was a difficult process?
No. I think the key thing is two-step-fold. One, seeking the expertise out of ECW, but then also knowing what you want out of it. So when you go into a training, you want to know what you're going to get out of that. So It was clear what we wanted the providers to learn. We provided the workflows and how we wanted everything captured, basically our reporting. Mm-hmm. So once the providers learned where we needed them to document, everything else kind of worked itself out. Yeah,
that's a good way of putting it. I mean, the old cliche of you can't manage what you can't measure. Absolutely. That's one of the things that optimization actually helps you out so much in being able to manage and then measure.
Absolutely. So, and I think for staff, it's good for them to know that you are monitoring this and you are measuring in terms of compliance and making sure that everybody understands the value and what we need to capture and report. That's how we do it, through reporting. That's great.
That is really great. Now, I know that after the optimization was complete, you had a number of really great successes.
Yes.
But there are two in particular that I'd love to have you talk about, because the numbers behind this are really, they're amazing.
So we had huge improvements in two specific areas. First area being hypertension. So from the end of 2021 through the second quarter, we actually increased the hypertension compliance by over 20%.
Wow.
So for us, that was huge.
That is.
We had a clinical informatics person who monitored it for us on the back end, made sure the reporting was available. We provided that feedback back to the providers and the care teams, and they were ecstatic. The second one is we integrated behavioral health and the importance of depression screenings for all members. We were also able to increase by 20% over a 6-month period after the optimization visit.
Yeah, those numbers are really amazing. I mean, both for HTN as well as behavioral health. That's a great success. Congratulations on that.
Thank you so much.
And as I said, I know that you had others beyond that.
Absolutely.
But those two really they stand out just so well. So would you suggest optimization to...
I would encourage it. To be quite honest, we're doing another one. So right when I get back on October 30th, we're doing another training. This one for us is on the web version because, of course, as we're preparing to move to version 12, we were originally trained on the EXE model.
Sure.
Now we're training all our providers on the web version so they can get comfortable, so we can get to version 12 and use all the benefits.
Oh, that's fantastic.
Yes.
That is
Yes.
that is great. Having someone come back in a second time to help you out continually. That's one of the best.
I can tell you for me and the side we sit on the practice, right? Where we thought it was great also is that you actually got an opportunity to see if you were using the product maximally, all the benefits. And that's what
Right.
helped us, is there were certain modules or features that wasn't getting used. And through this additional training, you're able to ensure you're using the most of the product has to offer.
Yeah,
to you.
that's a really, really good point, because ECW does contain so much.
Yeah.
It's sometimes difficult for practices to get their arms around it
Right,
to some degree, but that's where the optimization comes in.
I would say I recommend it for all practice. It costs, but you're going to get it back twice fold through your clinical measures, your quality measures, your incentive program. So it's just a worthy investment, in my opinion.
Fantastic. Orlando, thank you so much for joining me
Thank you,
today.
Brian.
We really appreciate it.
Thank you, and thank you, ECW.
You're more than welcome. If you're interested in seeing more ECW podcasts, you can find them on my.eClinicalWorks.com, Apple Podcasts, YouTube, and now on Spotify. So this is Brian Saul along with Orlando, and we want to wish you a great day. And if you're at the conference, continue to enjoy it. If you're seeing this later, enjoy it as well. Take care, folks. Bye-bye.